Have you ever had that just gut-wrenching fear something's terribly wrong with your horse and you don't know what to do? Today we're diving deep, really deep, into one of the most critical, life-threatening conditions a horse can face. Equine large colon torsion. And look, this isn't just a bad bellyache. We're talking about an acute, severe, just relentless form of colic. It's a surgical emergency, full stop. Demands immediate aggressive action. We've gone through a stack of your sources, packed with veterinary insights. Our mission here is simple, really, to pull out every vital piece of knowledge for you. We want you to walk away understanding what makes this condition so incredibly dangerous and, maybe most importantly, what it really takes to save a horse's life when, literally every minute counts.
Exactly. And that urgency, that ticking clock, is precisely why understanding this is so crucial. The basics, how fast it progresses, the need for super quick diagnosis and treatment, it's paramount. Whether you're a lifelong horse owner, new to horses, or honestly, even just curious about animal health, knowing this stuff could genuinely make all the difference.
Okay, let's get into it. What exactly is a large colon torsion? Break it down for us.
Right. So imagine a big section of your horse's large intestine, the large colon, twisting on itself. Sometimes people say twisting on its root or axis. Think of wringing out a wet towel, maybe.
Okay.
That twist, it does two devastating things almost instantly. One, it physically blocks the gut, like a roadblock.
Yeah.
But worse, much worse, it chokes off the blood supply to that section of gut.
And the horse's own body kind of sets this up, right? The anatomy?
That's what's fascinating and also terrifying. The large colon is just enormous, huge. It's U-shaped, and critically, most of it is largely free-floating inside the abdomen.
Free-floating?
Yeah. Gives it a lot of mobility. Think of this huge, flexible hose pipe sloshing around in there because it's not rigidly fixed down everywhere, especially around certain bends like the pelvic flexure. It can literally tie itself in knots. It's got specific parts. Right ventral colon, sternal flexure, left ventral, pelvic flexure, left dorsal, diaphragmatic flexure, right dorsal colon. But it's that freedom, that movement, that unfortunately makes it vulnerable to these really dangerous twists.
Okay, so the twist happens. What's actually going on inside that makes it spiral so badly, so fast?
Pathophysiology?
Right, the mechanics of the disaster, basically. So the twist itself is a rotation around the mesentery. That's the sort of fan-shaped sheet of tissue that anchors the colon. But, crucially, it also carries all its blood vessels. Lifeline, really.
These twists, they can range. Sometimes it's 180 degrees, like halfway twisted. Sometimes 270. Or even a full 360 degrees, or believe it or not, even more. Most often, they twist in an anti-clockwise direction, looking from behind the horse, and often right near the base of the cecum, another big digestive sac. So first thing is the blockage, luminal obstruction. The twist physically stops food material and gas from moving through. And this causes the colon upstream of the twist to just blow up like a balloon. Massive, rapid distension.
Okay, blockage is bad, but you said the blood supply part is worse. The vascular compromise, strangulation.
Exactly. That's where it gets really critical, really fast. Even a smaller twist, say 180, 270 degrees, it might pinch off the veins first. They're thinner walled, easier to compress.
Right.
So blood can still get in through the arteries, maybe, but it can't get out through the veins, like kinking a garden hose just enough so water pools up.
Okay, I can picture that.
This causes intense congestion, swelling, edema, bleeding inside the wall of the colon itself. It's often called hemorrhagic strangulation. And this damage makes the lining of the colon start to slough off, which just adds to the fluid and gas buildup inside. Nightmare.
And a bigger twist, like 360?
That's even worse. A full 360 twist or more usually clamps down on the thicker-walled arteries, too. Now you've completely kinked the hose, no blood getting in at all.
Total cutoff.
Total cutoff, rapid ischemia, lack of oxygen, and very quickly, necrosis, tissue death. And this is terrifyingly fast. The inner lining, the mucosa, can be completely dead within just 4 or 5 hours.
4 to 5 hours, wow.
Yeah, and it doesn't stop locally. This damage has system-wide effects, huge effects.
So?
Well, that damaged gut wall, it's not a barrier anymore. Bacteria and these potent toxins they produce, called endotoxins, leak right out of the gut and into the horse's bloodstream.
Oh, no.
Yeah. This triggers a massive body-wide inflammatory response. We call it SIRASHA, or systemic inflammatory response syndrome. It leads directly to endotoxic shock.
And that shock is a killer.
It's a primary cause of death in these cases, absolutely. The whole cardiovascular system just starts to collapse. It's catastrophic. And on top of that, think about all the fluid. Huge volumes of fluid and vital electrolytes get trapped, sequestered in that swollen, distended, dying piece of bowel.
So they get dehydrated super fast.
Exactly. Severe dehydration, low blood volume hypovolemia, loss of protein, and critical imbalances in electrolytes like sodium, potassium, chloride. It's a perfect storm systemically.
That is just a terrifying cascade. So for the listener, for you out there with a horse, what does this mean? What are those specific warning signs? And are some horses just, more likely to get this?
Absolutely. There are definitely predisposing factors we look out for. Brood mares, for instance. They're at a significantly higher risk. Some studies say up to 13 times more likely than geldings or stallions.
13 times. Why?
Well, it's thought to be related mostly to the period right after foaling. Suddenly there's all this extra space in the abdomen where the foal used to be. Pressure changes. It gives the colon more room to shift around, potentially twist. Also, mares in late pregnancy and those who foaled within the last, say, 90 days seem to be at increased risk, too.
Okay, brood mares. What else?
Age is a factor. We tend to see it more in adult horses, not so much young foals. And management changes can play a role.
Like what kind of changes?
Sudden shifts in diet, like adding sugar beet is sometimes mentioned. Increased time stuck in a stall. Changes in exercise routines, even stressful events like, traveling long distances. The thinking there is maybe these things cause the gut to slow down a bit, hypomotility and gas builds up, and that combination might sort of initiate a rotation. Other things mentioned are a previous history of colic, maybe taller horses having a slightly higher risk, and just general gas accumulation, tympany.
Is it genetic?
Interestingly, no. There's no known genetic basis for this specific condition. And just to give a sense of how often this pops up in severe colic cases, studies suggest maybe 10 to 25% of horses needing colic surgery actually have a large colon volvulus or torsion.
Wow, that's a lot.
Yeah, and in places with lots of brood mares, the numbers can be even higher. One study found that in their surgical cases, almost 2/3 involved a severe strangulating twist, like over 360 degrees.
Okay, so it's common, it's deadly, it's fast. How on earth do vets diagnose it when the clock is ticking so aggressively?
You nailed it. Time is absolutely the enemy here. Rapid assessment, making quick decisions, it's essential. These horses can go downhill incredibly fast, often within like 4 to 24 hours from when you first notice something's wrong.
So what are those absolute drop everything call the vet now signs? The hallmarks?
The biggest one, severe, acute, unrelenting belly pain. Just awful pain. The horse will show violent, continuous colic signs.
Like what?
Aggressive pawing, rolling violently, maybe throwing themselves down, thrashing around, and crucially, they get little or no relief from strong painkillers. Or maybe the pain meds work for like 10 minutes, then they're right back at it. That pain, unresponsive to drugs, is a massive red flag.
Okay, intense pain. What else?
You'll see things progress really quickly, often marked abdominal distension. Their belly, especially in the flanks, looks bloated, and it gets worse over time. And signs of shock develop rapidly.
Shock signs like...
Really high heart rate often jumps up quickly and stays high, like over 60, often over 80 beats per minute. And honestly, a heart rate over 80 is a really bad sign for survival. Their gums, the mucous membranes, they'll look pale or even bluish, cyanotic, kind of muddy or purple. That means poor oxygen flow. Capillary refill time, press on the gum. See how fast the pink comes back. It'll be slow, more than 2 seconds, often more than 4. Their legs and ears might feel cold. Their pulse, if you can feel it, will be weak and thready. They might be sweating like crazy. Also, usually no manure output right because of the blockage. And gut sounds. You listen with a stethoscope, and it's eerily quiet. Reduced or totally absent sounds in all parts of the belly, and as the shock gets worse, they might stop thrashing and just become really depressed. Lethargic, almost apathetic, which is also a very bad sign.
That paints a really grim, clear picture. Okay, the vet arrives, sees these signs. What diagnostic steps do they take, like right there in the field or clinic?
It's about a rapid, systematic colic workup. First off, and often highly diagnostic, is a rectal palpation. The vet carefully examines internally. The most common finding is just massively distended, gas-filled large colon. Feels tight like a drum. Often it's out of place, maybe feels swollen, kind of doughy or edematous. Sometimes you can actually feel the twist itself or the tight bands of the mesentery pulling on it.
Can they always feel it?
Not always. It can be really hard, sometimes impossible, in a horse that's violently painful. And sometimes the twist is positioned where you just can't reach it. So a normal rectal doesn't rule it out, but finding that huge gas distension is a very strong indicator.
Okay, what else?
Nasogastric intubation. Passing a tube into the stomach. Standard part of any colic exam. Usually with large colon torsion, you don't get much fluid back from the stomach. maybe a little gas. Then abdominocentesis, we call it a belly tap, taking a sample of the fluid that's normally in the abdominal cavity.
What does that tell you?
A lot, actually. With a twist, that fluid changes fast because stuff leaks from the damaged bowel wall. It often looks bloody tinged, what we call serosanguineous, or cloudy, turbid. If it's reddish-brown, that strongly suggests strangulation dead or dying gut. We also analyze the fluid. Look for high protein levels, often way up, high cell counts, and really importantly, high lactate levels. Lactate is a big indicator of ischemia, that lack of blood flow and oxygen to the gut.
Got it. Any imaging, like ultrasound?
Yep, abdominal ultrasound is a really useful tool. It can quickly confirm there's significant large colon distension, but the key finding we look for is a thickened large colon wall.
How thick?
If we measure it from the outside through the belly wall, and it's thicker than about 9 millimeters, that's highly suggestive of a strangulating twist, because that wall is getting swollen and congested with blood and fluid. Sometimes ultrasound can even help pinpoint which parts are displaced.
And blood tests?
Absolutely critical. Blood work tells us about the horse's overall systemic state. A CBC, complete blood count, often shows hemoconcentration. The blood gets thicker from dehydration. White blood cell counts can be high or low, indicating inflammation or severe infection and or toxemia. Serum biochemistry, we look for that elevated L-lactate again. If it's really high, say over 6 millimoles per liter, that's generally associated with a poor prognosis. We also check for muscle damage enzymes, electrolyte imbalances, low sodium, chloride, potassium are common. It all paints a picture of how severe the shock and systemic damage is.
Okay, so with all this evidence pointing towards torsion and how fast things go wrong, it really sounds like just giving meds and waiting is completely off the table. What's the definitive plan?
You are absolutely right. There's no waiting. Large colon torsion is a surgical emergency, period. Medical management alone. It offers zero definitive cure. It's purely about trying to stabilize the horse for surgery, buying minutes, maybe an hour, not days.
So what does that pre-surgical stabilization involve?
It's focused on getting them as strong as possible to handle anesthesia and surgery. That means aggressive IV fluids. Huge volumes, often to combat the shock and dehydration. Potent pain relief drugs like xylazine, ditomidine, but torphenol. But again, if the pain just powers through those drugs, that's another strong sign surgery is needed now. We also start anti-endotoxic therapy. NSAIDs like flunixin, maybe polymyxin B, sometimes hyperimmune plasma, trying to counteract those bacterial toxins flooding their system. And sometimes a vet might perform decompression, carefully inserting a needle or trocar into the distended colon through the body wall to let off some of the trapped gas. This can temporarily relieve pressure, help them breathe a bit easier, but it is absolutely not a fix. It doesn't untwist anything.
Okay, so stabilization happens, horses rush to surgery. What actually happens on the operating table?
All right, so the surgery is called an exploratory laparotomy. It's a big procedure, done under general anesthesia, with an incision usually right down the middle of the horse's belly, the ventral midline. The surgeon has several key goals. First, find the twist. Identify exactly where and how the colon is twisted, and then carefully manually untwist it. Restore the normal anatomical position, hoping to restore blood flow.
That sounds delicate.
It is. Then second, and this is absolutely crucial, assess bowel viability. Is the gut tissue still alive? The surgeon looks at the color. Is it pinkish red or dark purple, black? Is there motility? Does it contract? Are there pulses in the arteries supplying it?
And what if it looks bad?
If the colon looks viable, pink, maybe some motility returns, pulses are okay, then usually after untwisting, it's left in place. But if sections are clearly non-viable, necrotic black, purple, friable, no blood supply, maybe even ruptured, then that dead section may need to be resected, cut out.
Removing part of the colon?
Yes. A large colon resection is a major surgery itself. Much longer, much higher risk, and the prognosis becomes significantly more guarded. Third goal, evacuate the contents. That massively distended colon is full of gas, fluid, ingesta. It's heavy, bulky. So the surgeon usually carefully empties it out to reduce the weight and distension before closing. Fourth, lavage the abdomen. Thoroughly rinse the entire abdominal cavity with sterile saline solution to wash out any bacteria, toxins, or contaminants that might have leaked. And fifth, sometimes, maybe optionally, they might do a prophylactic procedure, like a colopexy.
What's that?
That's where they suture a part of the large colon, usually the left colon, to the inside of the body wall. The idea is to try and prevent it from twisting again in the future. It's not always done, more often considered if the horse has had a torsion before. But overarching all of this is timing. I can't stress it enough. Prompt referral to a surgical facility, getting that horse into surgery ASAP. The longer the delay between the start of signs and the surgical correction, the higher the chance of irreversible bowel damage, the worse the prognosis.
Is there like a critical window?
Studies definitely show a survival advantage for horses that get surgery really fast, like less than 2 hours from the onset of those severe signs. But even within 4-6 hours makes a huge difference compared to longer delays.
Okay, surgery's done, hopefully successfully. What happens then? Recovery must be intense.
Oh, incredibly intensive. The postoperative period is fraught with potential complications. So management is aggressive, continued 4V fluids, often for days, broad-spectrum antibiotics because of the risk of infection from the damaged gut, continued anti-endotoxic therapy. Pain management is key, often using a continuous rate infusion, a CRI of drugs like lidocaine, maybe opioids to keep them comfortable, and absolutely critical, laminitis prophylaxis.
Preventing laminitis, why is that so important here?
Because that endotoxemia, the toxins flooding the system, it's a major trigger for laminitis, which is inflammation in the feet, incredibly painful and can be devastating, even fatal in its own right. So things like digital cryotherapy, constantly icing the feet and providing support to the soles and frogs are standard practice.
Makes sense. What about getting their gut working again?
Yeah. Gastrointestinal support is important too. Sometimes prokinetics, drugs to encourage gut motility are used. We monitor them constantly. Vital signs, comfort level, gut sounds. Feed is only reintroduced very slowly, small amounts, once gut sounds are back and they seem comfortable. And activity is heavily restricted, usually strict stall rest for about 4 weeks with just short daily hand walks. Then maybe small paddock turnout for another 4 weeks, and then a very gradual return to exercise over the next month or so, weeks 9 to 12. It's a long haul.
It absolutely sounds like a harrowing experience for the horse, for the owner, for the vet team. So, bottom line, what's the ultimate prognosis? What are the chances and what really swings the outcome?
Yes, tough. The overall prognosis for large colon torsion is generally stated as garde de fer. It's a major reason why horses die from colic, especially colic needing surgery. The factors influencing the outcome. We've touched on them, but let's recap. Time to surgery is number one, absolutely the most critical factor. Get them corrected within a few hours, maybe less than 4-6 hours. Survival could be as high as 80-90% in some reports. Delays. The odds drop significantly. Degree of torsion. Those bigger twists over 360 degrees usually mean faster, more severe arterial blockage, more damage, worse prognosis. Bowel viability to surgery, huge factor. If the gut looks okay after untwisting, no resection needed. Better chance. If large sections have to be removed. Prognosis takes a big hit. Resection significantly increases risks and recovery challenges. Severity is systemic compromise before surgery. How bad was the shock? High heart rate, really high PCV indicating dehydration, super high lactate levels. Those are all negative prognostic indicators. And then postoperative complications. They're common and they can be killers. Persistent endotoxemia, laminitis developing despite precautions, post-op ileus where the gut just doesn't start working again, severe diarrhea, surgical site infections, incisional hernias. The list is long. Also, the colon can rupture, either before they even get to surgery or sometimes during the procedure itself. Pregnant mares might abort their foal. And recurrence, especially in those brood mares we talked about. The risk can be significant. Some studies say maybe 15% after one torsion and potentially much higher, even up to 80% reported after 2 episodes, though one paper did report a lower recurrence rate around 5%. And lastly, a practical factor. The owner's financial commitment. This is intensive, prolonged, expensive care. It's a significant factor in decision-making, unfortunately.
So putting all that together, what are the typical survival numbers people might see?
It varies a lot in the literature, depending on the study population and how quickly horses got treatment. Survival rates to hospital discharge are often reported anywhere from, say, 35% on the low end up to maybe 74% in more successful series. In the very best scenarios, with rapid diagnosis, referral, and surgery on a horse whose gut is still viable. Short-term survival might approach 90%. But it's also sobering to know that a significant chunk, maybe 19% to 33% of horses with these strangulating twists, don't even recover from anesthesia. The damage is just too severe when they open them up.
And long-term, like a year later.
Long-term survival, say to 1 year, is often lower, sometimes less than 50% in broad studies looking at all types of torsion cases. But for the horses that do survive to go home, many of them can and do return to their previous level of athletic use, although some might be prone to recurrent colic episodes or have other lingering issues.
So the big takeaway here, the summary. Large colon torsion is just about as dire an emergency as you can get in a horse. Rapid recognition, seeing that severe, unrelenting pain, the shock signs followed by immediate vet attention, and crucially, immediate referral for surgery. That's the only pathway to maximizing the chance of survival. Without surgery.
Without surgery, the outcome is unfortunately inevitable. They will not survive.
Wow. This deep dive has really laid bare the incredible complexity, the sheer urgency of equine large colon torsion. From the specific way their gut is built that sets them up for this, to that terrifying cascade of events inside their body, and then the rapid fire, complex response needed from vets. It's just crystal clear that every single minute counts.
It really is remarkable, isn't it? How understanding the precise anatomy, knowing those physiological steps, how it all goes wrong,
Yeah.
and then combining that with human intervention, speed, and skill. How that all comes together to offer a chance for life in what seems like an impossible situation. It really underscores the profound responsibility we have when we care for these animals.
So what does this all mean for you listening? Whether you're a dedicated horse owner, maybe a vet student trying to absorb all this, or just someone endlessly curious about the animal world, maybe consider this. We live in a world flooded with information, right? Sometimes it feels overwhelming, but the story of large colon torsion is a stark reminder. Sometimes the most valuable knowledge isn't just knowing something, but understanding the critical speed at which that knowledge has to be applied. It challenges us, I think, not just to gather facts, but to grasp the profound impact of time in these life or death moments. So the question to leave you with is, how might that principle, that need for rapid informed action, apply in other parts of your life beyond the barn? Where else can quick understanding and decisive action completely change an outcome?